Good afternoon to all. I am SINDUSHA from Rangaraya Medical College, Kakinada. Today I am going to present on the topic Clinical Outcomes of Post-Covid-19 Rhino-Orbito-Cerebral Mucormycosis. Mucormycosis is a rapidly progressive, devastating angio-invasive fungal infection caused by filamentous fungi of Mucorrhizae family, and spread occurs due to inhalation of fungal spores which colonize and infect nasal or sinus mucosa first, then spread to orbit and drain. Based on the anatomic side effects, mucormycosis can be classified into many forms, out of which ROCM is the most common. ROCM usually occurs in immunocompromised individuals. It has shown a rising trend in the setting of COVID-19 pandemic due to added angioinvasion and endothelial damage due to thrombotic microangiopathy and other factors. ROCM is associated with high mortality ranging from 25 to 62%. We have done a cross-sectional prospective interventional study at our institute in 210 patients for a period of 3 months, where all post-COVID ROCM patients were included and patients who had ROCM due to non-COVID-19 infection causes were excluded. All patients who presented to our OPD with red flag signs were suspected to have mucormycosis infection. For those patients, RT-PCR was done and COVID-negative patients were admitted included in our study. They were subjected to thorough evaluation. Diagnostic nasal endoscopy was done and deep nasal swab was sent for microbiological examination. These patients were subjected to radiological evaluation, which included CT and MRI with or without contrast according to necessity. The following laboratory investigations were done in all patients, which included complete blood picture, blood sugar levels, RFT and others. Based on all these findings, patients were categorized into stage 1, 2, 3, 4 and managed according to the provided guidelines. Stage 1 included patients with only nasal mucosal involvement, stage 2 with sinus involvement, stage 3 orbit involvement and stage 4 CNS involvement, and they were treated accordingly. TRAM was given to patients with preserved vision and progressive disease, those who cannot be posted for immediate FES due to various reasons, and following sinus debridement where orbital wall has been breached. All patients were continuously monitored by a team of doctors and treatment continued. Outcomes observed were survival or death of patients. At the time of discharge, all patients were given step-down treatment with taposoconazole and followed up every 2 weeks. Then results. Of the 210 patients, right eye was involved in 100 patients and left eye in 110 patients. Bilateral involvement was observed only in 2 patients. One patient had a comorbidity of HIV infection and in other patient there was uncontrolled diabetes. The mean age was 55 plus or minus 12 years. In our study, 71% were males and 28% were females. The mean duration between COVID and ROCM was 23 days. The commonest comorbidity observed was diabetes, out of which 64% were known diabetics and 28% were de novo diabetics. The mean blood glucose level was 316 mg per deciliter. Most of the patients, that is 30%, presented with stage 2 ROCM followed by stage 3. Almost 85% patients presented with facial or sinus or tooth pain, followed by facial edema, periorbital edema, ptosis. Ischemia or eschar, proptosis, periorbital discoloration. Chemosis, dacrocystitis, lid abscess. Majority of patients, almost 40%, presented with decreased visual acuity ranging from 6 by 18 to 6 by 60. These were some of the DNA findings which we observed in our study. Then fundus findings. A 45-year-old male patient presented with CRAO changes in fundus. A 30-year-old female ROCM patient presented with optic atrophy changes. On 10% KOH mount examination and microbiological culture, Rhizopus species were mostly isolated, followed by mucor. The most common radiological feature was sinus involvement in almost 80%. Then management. TRAM was given for 50 patients, orbital decompression done in 70 patients, and 10 patients required orbital exentration. With the treatment, 71% patients survived and 28% succumbed to mucormycosis. The mean duration to follow up is 8 to 12 weeks. She is a 62-year-old female patient who presented with left eye complete ptosis, periorbital edema, chemosis, and ophthalmoplegia. After treatment, there was resolution of orbital inflammation and recovery of ocular movements. He is a 72-year-old male patient with left eye panophthalmitis. He underwent FES with total orbital exentration. And histopathological examination confirmed mucormycosis. The most common risk factor associated with ROCM was diabetes, seen in almost 93%. In our observation, the severity of ROCM is directly proportional to the diabetic status. COVID patients are more vulnerable to fungal infection due to compromised immune system, associated comorbidities, and decompensated pulmonary function. The use of steroids for treatment of COVID and worsening glycemic control provide an opportunity for mucor to become invasive. In our study, orbital involvement was noted in 51% and 22% had CNS involvement. Early diagnosis is possible through high index of suspicion for red flag signs of mucor. DNA should be done in all patients, and serial radiological evaluation for a minimum period of 6 months is necessary because radiological features precede clinical manifestations and they take longer time to resolve than clinical signs. Systemic antifungals along with extensive surgical debridement are the mainstay of treatment. In our study, stage 1-2 patients were started on posaconazole, stage 3-4 patients on amphotericin B. The response observed with posaconazole was found to be almost equal to amphotericin B. Surgical debridement played a major role in our study. In our study, almost 24% patients were given TRAMP, and we observed that it has halted intracranial extension. As a life-saving measure, orbital exentration was done in 10 cases with no visual potential with extensive orbital involvement and rapidly progressive infection. 9 out of these 10 patients survived and recovered from ROCM. In our setting, the mortality was 28.5%, mostly seen in patients with uncontrolled diabetes, orbital epics and CNS involvement, and steroid usage during active phase of COVID-19. Lastly, I would like to conclude that the morbidity and mortality of ROCM can be reduced by early diagnosis and treatment through a coordinated effort from a multidisciplinary team. Thank you.